Oftentimes I wake up to the sound of screaming. Usually it's my daughter, sometimes it's just me and the things that go along with life, but it is what it is.
I usually wake up at around 5:30. I have my cup of coffee, and then I stroll on over here. It takes me about 15 minutes to get here.
Hello, guys.
Morning, Kat.
Good morning.
I require about 3 alarms to wake up. I do set about 12, just as an insurance policy.
Favorite thing about morning rounds, I like rounding with Ashley. We walk down the catwalk, making jokes on the way, and I think that's my favorite part about morning rounds.
I save my Red Bull so for after we're done rounding. It's a little treat.
Look, it's got vitamins. Calcium, niacin.
I love her. She's awesome.
In the mornings, we tend to play kind of zone defense with rounds. It can get quite busy at times, so we'll split the entire adult list equally amongst all of the junior residents, who will then buddy round in small teams with a senior resident. And then one of the junior residents is always our pediatrics chief, and so they'll round on the pediatric service to start their day.
Usually I buddy around with one of the junior residents and try to impart the knowledge that I can during those few moments we have together to share. Then we go down, we have breakfast together where we do sign out in the cafeteria, flat breakfast if that's what you're doing that day, and huge waffle, eggs, bacon, protein shake, everything you need to get through a flap. So
one of the strong points about this program is that you get to operate a lot, not just as a senior resident, but as a junior resident as well. I got to be the first assist on a micro case. This was towards the end of my second year. I never was made to feel that I didn't know what I was doing. Instead, attendings just took extra time to make sure they taught me, and I feel so much more comfortable assisting on micro cases after that.
Did radial forearm free flap for a patient with an oral cavity carcinoma. So that was a nice recent experience that I had, and where I did kind of the majority of the case, including the vascular anastomosis, and then was able to see the immediate post-operative care, and then the first post-operative visit was nice.
As an intern, I was kind of surprised because even my first week on my first rotation in ENT, we got into the operating room and I was first assist. That was a little bit scary at first because I didn't know what I was doing. Actually, as the year progressed, that was a great experience.
The attending to resident ratio is very high, so there are a lot of OR cases that and many times you're the only resident there helping.
I feel like I operated a lot as an intern and was doing a lot of awesome cases that I didn't imagine doing as an intern. I have used a scalpel to cut lymph nodes off the jugular vein. I have dissected on the facial nerve, on the recurrent laryngeal nerve.
As a second and third year, you rotate through pediatric ENT for about 4 months. In your second year, 4 months in your third year. You're the only person operating with the peds patient, so got to do cochlear implants, kind of worked my way from a simple cortical mastoid to how to look for the facial nerve. Working with pediatric patients is a little bit more difficult. It's a smaller space, you need more precision. I don't know, I've enjoyed my pediatric rotation my second year, and I'm loving my third year right now.
As of right now, 2,700 cases. As I start my chief year, I have all my requirements met except for a few sinus cases. Other than that, I could graduate.
In the OR, some of the cases are very long and you're doing one thing all day, whereas in clinic you're seeing 20 different patients, and they all have different pathology.
My favorite clinic day by far this past year was when I was in Dr. Spafford's Botox clinic. He has patients from all over the states and the surrounding areas with neurological or functional laryngeal problems like spasmodic dysphonia, and they all come in every couple of months to have Botox injections in their laryngeal muscles. And we had about 12 patients the last time we were there. I watched the first one, and then Dr. Spafford let me do every single other injection by myself, and it was awesome.
I'm actually involved in a lot of research right now. One of the research projects I've done is with Dr. Cry. We did a retrospective review on cleft palate repair using a Vomer flap. We do a lot of cleft palate surgery here, which is really cool.
One of my favorite moments from this last year was one of our research days in the OR. Dr. Boyd and Dr. Olson and I are working on a study where we're checking parathyroid values throughout the entirety of a case from induction to completion. It was just fun to have Dr. Olson there with his clipboard, jotting down all the events, and Kelsey, one of our PAs, was there helping us as well. And Dr. Boyd and I were operating, and it was this great teamwork environment to do both the research and the case at the same time.
There feels like infinite opportunities for clinical research here. One of them is I'm working with Dr. Olson to standardize our post-operative thyroidectomy pain control and hopefully minimize opioid use. And then Dr. Boyd and I have been working on some pretty neat artificial intelligence applications for various head and neck pathologies. Most recently, we presented our work with AI and thyroid pathology at the department symposium, and I actually won first place with my podium presentation, so that's pretty cool. I'm excited to see where that research goes.
Like many other programs, we are home call. However, being the only level 1 trauma center in the state and pretty much the referral hospital for most ENT related issues, we are super busy most of the time.
When I started here, we had no post-call days, and so you would be expected to go to clinic or be in the operating room the next day after like even a full night here. We were feeling like that was going to be a little bit much. So Dr. Micklejohn had a meeting with us like one Wednesday after conference, and we talked about where we were at in terms of burnout from call, and we said, I think something needs to change. And by the end of the week, we had this new plan in place to have a post-call day. It was kind of ratified by the attendings, and it was in place the next week. So when it comes to responding to the needs of the residents, this place just does a phenomenal job.
Understanding each other, knowing each other really well gives us the ability to really work well together as a team and step in when you realize someone maybe just needs a break.
In our shoulders, they'll get you.
Procedure. And that way it's in the
Oh boy.
surgeon.
So I start my ENT rotation on Tuesday, and I'm relieved that I will have an APP to show me how the floor works for the first week. It's also amazing to have the resource of APPs here because they can help with the floor work so that the intern and other residents can maximize their operative experience and aren't pulled out of the OR.
Yeah, I did my sub-I here last fall, and I had such a great experience. You hear ENT doctors being like some of the nicest people and nicest surgeons you'll meet, and that definitely rings true here at UNM.
So we each have a mentor, an attending mentor assigned to us. So my mentor is Dr. Cry, and she's amazing. It just helps me stay on track, and it's really nice to have someone there like rooting for me in the end, and making sure that I'm doing the things I need to do to get where I want to be.
We really make a difference in a lot of patients' lives here. New Mexico is a great state, and unfortunately there's a lot of poverty here and a lot of underserved population, and I think it is challenging sometimes because we encounter a lot of issues that we can't fix because of the social issues and health disparities, but I think we can certainly make a difference here.
It's no lie that as a surgical resident, we work quite a few hours every week, but a special part about working at the University of New Mexico is that when you're serving and working those long hours, you truly feel like you're helping other people and that you're actually serving people who need care. When you're on call and you get paged or you get consults, it's from patients who really need your help, and all the work you're doing feels productive and meaningful and worthwhile. We're 100% committed to our mission of caring for every patient that needs it who walks through this door, and that just makes your experience here so much more valuable.
My favorite thing to go home, after work, is honestly to just hang out with my husband. We hang out with co-residents a lot as well. I think we're all pretty close, so it's fun when we get a chance to just grab a bite after work sometimes.
Locally, there's downtown, there's different bars, clubs, and also music venues, Broadway shows, Santa Fe Opera, things of that nature.
Coming from South Dakota, Albuquerque alone was like this new place to explore, and so that's pretty much like all I did for the first 2 years. But I think one of the real beauties of New Mexico is getting out and seeing all the places outside of Albuquerque. One of my absolute favorite places to go now is Taos. It's just absolutely beautiful. You just go up there and get a cabin or somewhere to hang out on a weekend and get out and do some just world-class hiking. Other places I've been that I really enjoy is White Sands, because you can go like sledding on the sand, which is so cool, and the sand is like super cool even when it's like 100 degrees out. Going to Santa Fe is wonderful as well. There's so much to see and do there. They have a great restaurant scene as well.
We went to a hotel rooftop to watch the sunset, which was incredibly beautiful and definitely a major thing that won me over about coming here. And I felt like when I was watching the eastern side of the sunset, I was missing half the show because I wasn't looking west and vice versa. So I was consoled that I will have many more sunsets to watch here.
You know, not a lot of people know or think about New Mexico. It's kind of this hidden jewel. I came here because I thought that the experience I would get here would be very broad, and I was totally right in coming here.
It is a place where you do have to work hard. You're going to operate a lot. You're going to see a lot of patients. But on the product of that is that you come out of this program ready to run your own practice day one once you graduate.
Come to New Mexico. It's honestly such a great place.
We've got a dream team. We'd love to have other amazing people join us on our dream team.